We are grateful to our donors and development partners such as PEPFAR, and thank you very much, Ambassador, for the US continuing to fund many of our AIDS programs. We thank you and we say, please remain committed. Do not disengage. You have been our partners in this struggle. We want to see you continuing being our partner.
Good afternoon. Thank you so much for that warm welcome and the acknowledgement of the contribution that my country has been privileged to make towards the eradication of HIV and AIDS in this country. I will follow the good doctor's lead and dispense with many formalities and acknowledgements, but I will acknowledge your honorees. I will salute those who are in this room who are themselves HIV positive, but to continue to labor righteously and selflessly on behalf of others in this country. And I will, of course, acknowledge a dear friend to the United States, Deputy President Cyril Ramaphosa. Deputy President, I have to tell you that before speaking here, I had the honor of touring the community village. And as I entered the community village, I heard Zulu drum beats going on, and I foolishly thought that it was for me, but of course discovered that a greater man had preceded me into the tent. So always an honor to share a stage with you. I want to thank the organizers of this conference for inviting me to speak. It's indeed a privilege to be among this distinguished panel and to address this uniquely qualified group of experts. I'm humbled to be able to represent the American people in this hall of heroes, amongst great leaders who are committed to making every single sacrifice that you must every day in order to save every single life that you can. As you know, our work in this field is largely funded by the U.S. President's Emergency Plan for AIDS Relief, also known as PEPFAR, the U.S. government initiative to save lives of those infected with HIV and AIDS around the world. The PEPFAR commitment by the United States is the largest by any nation to combat a single disease internationally in the history of humankind. The U.S. has contributed more than $4.5 billion, or 56 billion rand, to South Africa alone in this effort. Mr. Deputy President, you'll please allow this political aside. I hear so much about the contribution that others are making in sub-Saharan Africa of late, and I'm asked constantly by reporters what the U.S. is doing. We've been here with you all along and will continue to work diligently with you. PEPFAR has helped to save millions of lives globally since it began in 2003. Many of those millions right here in South Africa. People like Zama Mapumulo, a young woman in KZN who found out that she was HIV positive from her local clinic during a pregnancy test. While understandably devastated, Zama fought her fear and depression to do the right thing for her unborn child. Thanks to a successful PMTCT program led by the National Department of Health and supported by PEPFAR, her baby was born HIV-free. In June, he will celebrate his second birthday, and he is just as adorable and naughty as any 2-year-old in this country. But these are our shared miracles. Zama's story demonstrates South Africa's remarkable achievements, and we congratulate the South African government, and in particular, the National Department of Health, and your incredibly dynamic Health Minister, Aaron Motsoaledi, whose energies I cannot keep up with, for this success. We also want to say how proud we are to be part of your team, proud to work with you through our staff and implementing partners to deliver treatment and preventing services, as well as to assist in building capacity within your overall healthcare system. When preparing for this address, I was happy to see the theme of the conference is reflection, refocus, and renewal. This sums up in a nutshell what the U.S. government has been doing with our PEPFAR program, both here and in Washington, D.C., over the last several months. When reflecting on the past, we remember how far we've come globally since the early 1980s, when a mysterious disease began claiming the lives of many around the world. While those were dark days, many of you in this room committed yourselves to work to save lives and prevent new infections and to end the epidemic within our lifetimes. It has been extremely challenging. Victories have often been overshadowed by the rising number of new infections and a tremendously high number of AIDS-related deaths over the years. But no one can deny our dramatic progress. And that progress is possible because you all have kept the faith. You've counted up the cost, and you've been determined to continue to be governed by your moral compass in this work. As South Africa's strongest partner in combating the AIDS epidemic, the American people have reached across the globe for more than 11 years to support the South African response to HIV/AIDS and tuberculosis. As the largest single bilateral donor to the global fight to fight AIDS, TB, and malaria, the U.S. government further contributes to South Africa's grants from that source as well. PEPFAR has supported the South African government in a tremendous nationwide expansion of HIV and TB treatment, voluntary male medical circumcision, prevention among key at-risk populations, and support to orphans and vulnerable children. However, we still see very high HIV incidence rates, including a disturbing 7,000 new infections in young women globally each week throughout Africa. Sadly, we estimate that roughly 2,363 girls between the ages of 15 and 24 are infected in South Africa every single week. That's 350 today alone while we sit here and congratulate ourselves. This is simply unacceptable and needs to motivate a moral outrage and righteous urgency in all of us. It should also inspire us to be more precise and data-driven with our approach. The time has come to use evidence to put together a strategic and effective model to help South Africa gain control of the epidemic and sustain that control into the future, and that time is now. South Africa is a world leader in HIV treatment, but more specifically in innovations, game changers, and leapfrogging. We applaud South Africa's wisdom in using the investment case analysis of the HIV and TB response, an analytical process which has recently revealed important findings about what is truly cost-effective. We also strongly support South Africa's commitment to plan a district-level HIV response to the new HIV-TB district implementation plans. This is critical. The National Department of Health is charting a course to go where the virus is and to focus for impact to control HIV and TB. PEPFAR is 100% in support of this approach. To get control of these epidemics by 2020, we must reach the UNAIDS 90-90-90 targets. This is an excellent overall blueprint for action. For PEPFAR, it means that to get control of the epidemic by 2020 and ultimately to start to see the end of this disease by 2030, we need to do the right things in the right places right now. And this is PEPFAR's aim in moving forward with what we call focusing for impact. Focusing for impact involves working with stakeholders to strategically focus PEPFAR resources geographically and programmatically to support HIV/AIDS prevention care and treatment programs in the highest burden areas in order to support South Africa to achieve ambitious targets. It's well enough to have a one-size-fits-all approach, but we believe in following the epidemiology and following the greatest natural resource we have, which is the data. I like to say, in God we trust, but everybody else, bring data. We are prioritizing smart investments by supporting programs that are effective and efficient. We want South Africans to test regularly for HIV, and if HIV positive, to receive the highest quality of care and treatment services without facing stigma or discrimination, and to adhere to that treatment to reach viral suppression. By doing so, we will help those on treatment live longer, healthier lives. We are also putting a new priority on young women and girls who we know have been left behind in the global response. Last month, I was excited to hear the Deputy President speak to the particular crisis that young women are facing. We've got to meet this squarely. Currently in South Africa, young girls aged 15 to 19 are 8 times more likely to be HIV positive than young men of the same cohort. To address the high incidence of specific vulnerabilities of young women and girls, PEPFAR has joined with the Bill and Melinda Gates Foundation and with the Nike Foundation to launch what we're calling the Dreams Initiative, which will allow 10 African countries to ensure that adolescent girls and young women have an opportunity to live a determined, resilient, empowered, AIDS-free, mentored, and safe lives. I'm incredibly proud to announce today that South Africa is one of those 10 Dreams countries. This new Dreams Initiative is incredibly exciting because the resources received will be invested to provide the very best combination of evidence-based interventions to girls and young women to help them reach their fullest potential and remain HIV-free. What's new and different about Dreams is that we are offering girls a holistic, full package of services that they need to thrive, which touches upon health, education, economic empowerment, and psychosocial support. We are optimistic that together we can really make a difference. Zama and her baby are the evidence of the difference that we make when we work in partnership. After all, what we know is that when a girl has access to health services and is HIV-free, is included in economic investments, has a choice over when she marries and starts having children, and has the opportunity to realize her full economic and social potential, she isn't the only one who escapes poverty. She brings her whole family, community, and country with her because those girls are our leaders. It's inspiring to know we can change the game for young women and girls and that we have the potential to get control of the HIV epidemic by 2020 and end it once and for all by 2030. It allows us to look forward to 2016 and the return of the Durban International AIDS Conference. If we draw closer to work more collaboratively and with a renewed sense of urgency, enthusiasm, and commitment, we will have a good story to tell here next year. But what will it take? What will that renewal involve? First, we must base our programs on the best evidence. We must use that evidence to get the basics right at the service delivery level and to build on that, remembering that the individual patient is the center of all the work we do. We must continue to build collaboration between government and development partners, between and among different government departments, and between civil society stakeholders at the community and grassroots level. We must constantly learn and improve our programs. Innovation, including the use of the latest technology, will also be key to efficiencies and progressing quickly towards our muscular targets. In fact, innovation is the hallmark of the work that we've done together. We're excited to see that our bilateral partnership flourish in this regard, with joint work on science, technology, biomedical, behavioral, and implementation research driving an innovation agenda across the health sector. Collaborative research programs are addressing priorities from TB drug regimens to HIV vaccines, work with global implications beyond the borders of South Africa. Just 2 weeks ago, we all learned from the results of the landmark START trial that an early start to starting antiretroviral treatment improves outcomes for HIV-infected individuals. This study, supported by the U.S. National Institutes of Health and including South African leading researchers and volunteers, will improve HIV treatment worldwide. This is an excellent example of our collaborative work that has global implications. Another type of innovation, and one of my very favorites, can be illustrated by the U.S. support for the National Department of Health as they launched the Moms Connect program, which uses mobile technology to help improve health outcomes for pregnant women and mother-baby pairs. Mom Connect has more than 420,000 women already registered across this country, and this number increases every month. I hope all of you are going to work with me to drive towards that million mark in Moms Connect before the end of this year. Finally, we must not rest until we reach those in need of our communities. This effort means extending even further into communities to reach key populations like commercial sex workers, those who are most at risk of being HIV infected and yet are reluctant to visit a facility for fear of stigmatization and discrimination. In closing, This conference is a critically important opportunity for sharing of knowledges, best practices, and stories from the trenches. There can be no better reason to come together than to save lives. Let us all press forward, remembering that an AIDS-free generation is possible and that the people of our nations deserve that chance. Before I came out to speak with you, I had the great honor and privilege of meeting with a group of young men from Durban who had gone on their own voluntarily through a mobile circumcision program here, and they were telling me to a person that it made a difference in their lives, and now they're out proselytizing for this program. At the end of the day, despite the resources from the U.S., despite the brilliant scientists and innovators in your National Health Department, if we don't empower those young men and others like them to be at the leading edge of change here in this country, we won't meet our goals. But I know that working together, we're going to do just that. Thank you so very much.